Welcome to All Home Care Matters, the show where we discuss all things home care, with discussions on important age-related matters and topics. Brought to you by Enriched Life Home Care Services, the #1 rated home care provider in Michigan by Top Rated Local.
Hello, and welcome back to All Home Care Matters. If this is your first time visiting us here at the show, we want to say thank you for taking time out to be with us today. We appreciate how valuable everyone's time is, and that's why we try and make each episode here at All Home Care Matters something that will hopefully matter to you. Today, we're honored to welcome a different kind of guest. We're welcoming Yati Patel, who's a high school senior at Noblesville High School in Indiana. Welcome, Yati Patel. She is a senior student ambassador and team captain for this school year's HOSA, as well as Future Healthcare Professionals competition. She's currently a second-year student at Center for Sight and a senior at Noblesville High School in Indiana. After graduation, she's going to be pursuing a pre-med course with the intent of joining the field of ophthalmology. Welcome, Yati. How are you?
Good. How are you?
Good. So I just rambled off a bunch of stuff. Why don't you say it in your own words, exactly where you're at right now in your studies and what you're going to be pursuing?
Right now, I'm a second-year student at Center for Sight. I intern with 3 doctors. One's a surgeon, which is what I want to go into, and I also am a team leader for HOSA this year. And then for a student ambassador, I'm currently working with 3 juniors, kind of teaching them everything I learned last year. And every Tuesday, I host a Zoom meeting and I talk to them. And then starting next week, I'm going to be helping train them in clinic. So I feel like it really allows me to apply my skills. And then I'm also currently working with Dr. Austin Lifferth on a glaucoma study that surrounding like the effects of eye pressure response in correlation with weightlifting versus low impact exercise. And I will be presenting my research at the Indiana 2024-2025 HOSA competition, as well as maybe furthering the study for publication.
Wonderful. So you obviously have a passion for healthcare, and specifically it sounds like ophthalmology or the eyes. Yes. How has stepping into the healthcare world as a high school age student really impacted your learning abilities, and how you're kind of correlating that with your senior year versus preparation for, your freshman year of college?
I think engaging on hands-on learning in a clinical setting allowed me to gain like practical experience, which deepened my understanding with the concepts that I've already been learning in the classroom. I've taken like biomedical science classes and human body systems classes, and I feel like allowing me to perform what I've learned in a clinical setting lets me develop critical thinking skills and problem solving skills as I encounter real life scenarios rather than just sitting in a classroom and learning. And additionally, it also allows me to develop a sense of responsibility while dealing with like a professional setting, which enhances my overall academic performance and personal growth.
Well, where did your passion originate from? How old were you? Was this something you discovered you had a passion for in high school, elementary school, a little kid? Like, when did this all kind of really mature and develop?
It started, I think, when I was in elementary school. I had a favorite show. It was on Disney, Doc McStuffins, and I just wanted to grow up and be like her. And then I knew I wanted to be a surgeon. I just didn't know what field I would fall into. At first, I was thinking maybe like neurology, like something with the brain. And then junior year, I was presented with this opportunity, this internship. And then I realized that eyes is what I want to kind of step into, and I want to make that my career.
Can you expand on that a little bit more on the eyes? Like, was there that one moment when you're like, okay, this is what I'm meant to do. This is what I want to do. Or was there any rhyme or reason behind it?
I think the one moment that really was a turning point for me, like when I stepped in, I was unsure, like I don't know how much I really want to do this. But then I think like the turning point is when I got to watch a blepharoplasty, which is basically eyelid surgery, and I got to watch it, and I got to watch how he like interacts with the patients, and I like understand like how much the eye really is affected by like things such as diabetes, like diabetic retinopathy, and like just physical appearance. Like watching him like do all these procedures and working with the patients, I realized that like a lot more goes into the eyes than what you would think. And really like understanding that is what pushed me closer to the field of ophthalmology.
Okay. All right. So as you're, kind of doing a dual role right now, you're doing a lot of volunteer work, you're doing a lot of
Hmm.
hands-on clinical work, and you're also still a high school senior. What skills has interning and scribing with an ophthalmologist and optometrist caused you to develop that maybe you didn't necessarily have prior to?
Some skills that really developed after working with these doctors and at this clinic was learning medical terminology, patient care techniques, and the ability to document a patient's interactions accurately. Really having those one-on-one conversations with patients and actually understanding why I'm here and approving my attention to detail and observing like if the patient says this, then this might be what the problem is, and this is what I should maybe note, or also working closely with healthcare professionals. It allowed me to enhance my teamwork and coordination abilities, effectively communicating with medical terminology, and just allowing me to develop a sense of professionalism that I otherwise probably would not have developed at an earlier age.
Yeah. I know kind of what you're kind of hinting on is taking a history, right? Sometimes it's
Mhm.
a verbal history, sometimes it's, a nonverbal history, being able to really identify those areas that patients may be trying to express something, but they don't know how to express it accurately, or they may
Mhm.
not even know what the cause is. And, getting a patient history is one of the main things you really focus on, and especially in that first year of medical school. So how do you think that developing those communication skills now are going to help you 4 years, 5 years down the road when, you're a year one medical student?
I think effective communication is essentially the key to building trust and like having that bond with a patient, which is essential for providing high quality care. And by developing these skills early, I can learn to explain medical information in a way that's understandable to patients, ensuring that they feel informed and comfortable while also knowing that they can ask me if they don't understand anything. But good communication also involves active listening, as you were saying, really listening to their needs and understanding their concerns in a more personalized way will allow me to give them more effective care.
Yeah, absolutely. So you're also a student ambassador at your high school there in Noblesville. How is
Yes.
becoming a student ambassador and teaching three juniors under you now what you have learned over the past year to improve your knowledge, and what doors has that helped to open for you that otherwise may not have been opened?
Well, right now, as I'm in my second year of training, I'm dealing with more meatier cases and just like harder um, patient interactions. Like I'm dealing with more of the surgical side now. I'm observing like cataract surgery and stuff like that. And I feel like teaching these students what I've learned last year, like the basics of glaucoma and macular degeneration, every Tuesday really helps me not lose that side of ophthalmology and optometry. As I want to go into ophthalmology, I really don't want to lose like the optometry side, like glasses and prisms and astigmatisms, and really allow me teaching them is allowing a better understanding on my side, just so I don't lose that as I'm learning new information.
So what have you learned since undertaking this about the eye that really has just blown you away and just fascinated you that you didn't even realize? Is there something that really sticks out?
Something that really stuck out to me is I wear contact lenses, and I know a lot of people do. I think the problems that contact lenses can bring, like dry eye syndrome or gland dysfunction, and sometimes in rare cases, even like corneal ulcers. I just think that me as like a contact lens wearer myself, as I've started learning about all the risks associated and everything, I've been better about taking my contacts out at night and everything like that. But that really is something that affected me personally, and that just blew me away. Like the amount of risks that I didn't even know were associated with contact lenses.
Talk about, and you may not know this, Yati, so I don't want to put you on the spot. And if you don't, it's totally fine. Talk about like cornea implants. I've been reading about they're doing implants now with cornea. Is that
I've heard a little bit about that. Not a lot,
okay?
but no, not.
Oh,
I
I
don't
didn't
think
know
I've
if the
heard.
surgeon you're working with, if he deals in the implants, or is that like a different level? Or I'm not real familiar with how ophthalmology and optometrists work. I didn't know,
Hmm.
is that a different level when it becomes like an implant situation?
I think he does. I basically, from what I remember, it removes the cornea's layer, so it removes like the damaged or the part that needs to be replaced, and then adds that back. But no, I don't know enough about it
No, that's
to really hit on it.
what other things are you involved with that relate to healthcare or even just volunteer work? Is there other things that you're passionate about?
Yeah, I'm the head chairman for the promotions committee for Riley Dance Marathon at my high school. Riley Children's Hospital is a hospital for children. It's one of the biggest children's hospitals where I live in Indiana and essentially the Midwest. And Riley Dance Marathon is a committee that raises money through for Riley. A lot of high schools and even colleges do it. It's really important because I know that a high school near us raises almost $500,000 every year, and this money that we raise is going for these kids. And something that we like to say is for the kids because we don't get anything out of this, but just helping people our age is something that is really important to us as a group.
Yeah, that's wonderful.
Mhm.
So let's talk about a little bit about your plans for after high school. You're going to be applying to colleges. You are in
Mhm.
Indiana, and we're in Michigan. I'm just throwing that out there. What college is your number one choice, Yadi?
The University of Michigan.
See, you're so smart. Um, are you doing any of the what are you looking at as far as a major when you go in the college? Do you have a
I
passion?
really wanna I really want to major in biology, but recently I've been thinking about a dual major, maybe history or English, because that's something I'm really strong in personally, my writing. And so I just feel if I do a dual major, then that could maybe help me improve on my like writing skills later, as far as maybe publishing research or something like that. I also maybe might want to do a minor in poli sci just because that's also something I'm interested in. Um, but my end goal is to be a surgeon. I don't know what specialty I want to focus around yet, but I'm heavily leaning towards ophthalmology.
Okay. Are you going to explore other areas, or do you think you're pretty much set on ophthalmology for the most part? Like
I
if
think I'm I think I'm pretty much set. I want to explore a little bit of like neuro-ophthalmologists, but I think I'm gonna stay pretty close with eyes.
okay, wonderful. What advice would you give to high schoolers or even middle schoolers who are looking at pursuing a medical career? What advice would you give them? Like, people I think often think, you know, you're still in high school, you're still in middle school, it's too early. I don't believe in that. I feel like you can always start as soon as possible to get involved and get exposed. What advice would you give to them if they're kind of thinking about pursuing a career in healthcare?
I agree with what you said. I feel like there's so many great programs, even though if your high school or middle school doesn't offer any, I feel like there's so many great programs out there. I mean, I know my internship, they have a program for even college students, like if they want to come in and if they want to spend a summer there, if they want to learn. There's just so many great opportunities out there. Even just a quick Google search could completely change your route. I mean, I never thought I would go into ophthalmology, and now it's, my career. It's what I want to do with my life.
Yeah. When do you send out your applications?
I've sent out a few. I'm gonna be done with applications by Friday.
Oh, wonderful. Wonderful. What was your second choice?
IU, Indiana University.
Okay. That's a good choice. Did you have a third?
Not really. I feel like Purdue is a pretty good option too, but I'm really looking at somewhere that ophthalmology and med school is offered. So,
Wonderful. Wonderful. So, Yati Patel, thank you so much for joining us today here at All Home Care Matters. We wish you the best. We're going to be supporting you. Looking forward to seeing your progression. And like I said, get that letter of acceptance from U of M. Make sure you send it to us, and we'll share it and celebrate with you. And thank you so much for your time today.
You're welcome. No problem.
Have a great day.
You too.
Thank you for joining us today here at All Home Care Matters. All Home Care Matters is here to help families as they navigate these long-term care issues. We invite you to visit us at allhomecarematters.com, where there's a private, secure, fillable form where you can give us feedback, show ideas, or if you have questions. Every form is read and responded to. And remember, you can listen to the show on any of your favorite podcast streaming platforms or watch the show on our official YouTube channel. Just make sure to hit that subscribe button. We look forward to seeing you next time here at All Home Care Matters.
Thank you for joining us today. We look forward to you joining us again on another episode of All Home Care Matters. To learn more about the show and to connect with us, visit us at allhomecarematters.com.